Mm.
Mm.
Is here.
Many.
So I can now send it to you.
Let me.
Just let's be a bit patient. We'll soon be sorted out with all this. Okay, thank you, ladies and gentlemen. Thanks for your patience. We are back on board. I'll be handing over to Mr. George Hembah without wasting more time. And while doing that, once he prompts me to bring on his slide, I'll be bringing on the slide and we'll move on with the slide the way he wants it to be. So, Mr. George Hembah, over to you. Please unmute yourself and let's go ahead. Thank you.
Okay, a very good evening to everybody once again. We're sorry for the little technical hitches that had come up, and we trust that we'll run with this as quick as possible. It's not in our culture to waste anybody's time, and this will not be an exception. So once again, I apologize, and we go straight into the discourse of the day. I'm trusting that by the end of today's presentation, we would have been able to, can I have the slide on, please?
Okay, okay.
Okay. Okay, thank you. So we can take to the first slide, please. Okay, our expectation should be that at the end of today's presentation this evening, we would have been able to, one, define the roles of a mental health counselor. Two, basic stages of counseling, because I want to believe I'm addressing mental health counselors this evening. So I'm talking to mental health counselors. The third thing is therapeutic communication skills. As a mental health counselor, there are some certain ways that you have to sit and address your patients. So there are some particular forms of communications you need to understand. I will attempt as much as possible to share and shed some light on some various communication skills that we should adapt. And then the third is the golden rule. So let's start. Can you hear me? I want to believe you can all hear me. So as a preamble to this discourse, I'd like to start by saying a mental health counselor will be relating to patients. So as a mental health counselor that you are, you're going to be relating to patients from different parts of the world, from different walks of life, from different religions, from different age groups, from different cultures, from different educational backgrounds. And to bring about different perspectives, we will be looking at the difference in how to address such kind of or group of people. In order for us to manage and handle our patients that we will be attending to, it is important that we know our roles as a mental health counselor. This leads us to the very first question, which I said where our expectation should be, defining who a mental health counselor is. Next slide, please. The next slide, please.
Yeah, hold on.
Who is a mental health counselor? We are talking about mental health counselor. We've gone through the training of being mental health counselors, and then we are now on the verge of becoming mental health counselors. Who are we as mental health counselors? And a mental health counselor is a professional that assesses and treats both the emotional health disorder, relationship issues, and life-changing. Yes, and life-changing challenges. Through various methods of physiotherapy, counselors work with patients to develop meaningful behavior changes and also offer coping strategies for navigating through life struggles. Now, it is important, definitely over the course of time, you would have been hearing some terms or some professionals. You have a psychologist, you have a psychiatrist, And then you'll be asking that, is a mental health counselor a psychologist? Is he a psychiatrist? Who is this person? So I would like to, in a little way, let us understand that they are quite different. When you're talking about a psychologist, when you're talking about a psychiatrist, they are different people. And then when you're talking also about a mental health counselor, they are different people. Yes, in the dynamics of works, they may have some similarities in the way of operations, but the trainings are different. So it would be very incorrect for you as a mental health counselor to introduce yourself as a psychologist. It would be very incorrect for you as a mental health counselor to introduce yourself as a psychiatrist. Let me quickly say, a psychologist usually is referred to a person that is trained in human cognition and behavior. A psychiatrist is trained in human cognition and behavior, but the difference there is that their functions are related in clinical presentations and treatments. That is in which area? Medications. Can we go to the next slide, please?
Okay. Taking time. Okay.
Now, there are 3 basic counseling stages of counseling. Now, when you sit down with your patients, there are 3 basic things to look out for in counseling. Every counselor must exhibit those 3 basic areas. The first stage is listening to your patient. It is very critical, it is very important that as a counselor, you listen to your patient. The second stage of counseling is developing a treatment plan. Because as a mental health counselor, your duty, as we had defined earlier of who a mental health counselor is a professional that assesses and treats mental and emotional health disorders. So, to create a coping strategy. Can we go to the next slide, please? Now, if you could remember, we said we're going to, the expectations was the basic stages of counseling, defining the roles of mental health, which we've done. Now we're going to be looking at the therapeutic communication techniques. As a mental health counselor, therapeutic communication is key. It is very important because you are not going to counsel your patients and be abusive towards your patients. Mind you, I said earlier on, a person suffering from a mental illness. And by the way, when we're talking of disorder or illness, we're looking at stuff like schizophrenia, we're looking at bipolar disorder, we're looking at drug abuse. We're looking at so many little areas that people go through every day in life. And then there is need for us to know how to communicate with such a person when he comes. The way you see a drug addict in the US, for example, and then the way you communicate with him is different from how you communicate with the same kind of drug addict here in Nigeria. Not because their color of skin is different, but because their culture has made them to relate or handle things in a particular perspective, and how they manage issues in their culture is quite different from how you are managing issues we here in Nigeria or in Africa manage issues. And permit me to say, when I see you as a mental health counselor, I see you as a global mental health counselor. So you are not streamlining your practice to just Africa or Nigeria, but you're going to be looking at things on a global perspective. So therapeutic communication techniques is very important. And what is this therapeutic communication? It's a collection of techniques that prioritize the physical, mental, and emotional well-being of patients. Because every patient goes through a disorder in a different form. So you need to apply some certain ways of how to communicate effectively with such a patient. It is important to know that communication skills helps you to connect more deeply with your patients. It is the heart of assessing a patient. What you say, how you say it, and your body language. What you say in communication skills is about 10%. How you say what you are saying is about 20%. And your body language is 70%. I will, in the course of time, try to share more light on these various types. We should also be observant of verbal and non-verbal communication to recognize emotional cues. Imagine you are sitting in front of your patient and then he's talking to you and jerking, or he's scratching his face. These are cues of non-verbal communication. And when you see such cues, you can now begin to start tracing and linking it up, that this person is probably going through a drug-related issue. He's probably into drugs and stuff like that. So when you understand those little cues, then you now know how to communicate accordingly and how to manage your patient. Next slide, please. So in the techniques, the first one that we're going to talk about is using silence. Silence, they say, is golden. And when you are communicating with your patients, there is need for you to be silent. It is not everything that your patient is going to say that you're going to comment and talk immediately. The first thing is silence, because you need to hear, you need to understand, hear what he's saying, listen to what he's saying, to be able to know the appropriate measure in handling the process of treating. So silence is very, very, very important. The next is accepting. You're sitting with a person that is going through a disorder in one area or the other. There is need for you to be able to let him feel accepted, let him feel loved. And if he comes in, imagine you are sitting on the consulting room and your patient steps into the room. And the next thing, you are frowning your face as a counselor. You have indirectly spoken to him non-verbally, and he will not be able to open his mouth to say anything. But imagine that same person comes in and you smile. And then not only smiling, but you're like welcoming the person in. He now begins to feel accepted as he's sitting, because normally those that go through a disorder, it is in most times very difficult for them to open their mouth to say anything. They need to be sure that they are comfortable to talk to you about anything. And your disposition matters a lot. So accepting them by showing them some form of acceptability, like I said, smiling, making them feel welcome to sit and be relaxed, is very, very important. Then, giving a broad opening. You will ask, how do you give a broad opening? Or better still, what is this broad opening? Because you're going to be talking to a patient, and then You just have to give him an impression or give him some form of acceptance. In therapeutic communication, it's often most effective when patients direct the flow of conversation. So it's not that when he comes, you now sit and say, so what happened to you? What's wrong with you? No. The first thing I said is using silence. Let him be the one to initiate a conversation. The second I said is accepting. Then giving a broad opening. In this case here, you are allowing your patient to be the one to initiate the conversation. And your duty at that time is to sit and actively listen. You sit and actively listen while he's giving that conversation. Let him decide what he wants to talk about, because they are going through so many things in their head. And then they are looking at, is it everything that they're going to share? Which part can they share? Which part are they going to hold back? But by interrupting them at certain points, we make them more careful. But when you give them that opportunity to talk about anything, and then you encourage that conversation by once in a while chipping in one or two things, it helps. So by giving them that broad opening, it opens room. It gives them way to be able to discuss about what is on their mind at that very point in time. The fourth thing is active listening. Like I said, by using non-verbal and verbal cues, such as nodding your head. So your patient is talking and you're nodding your head and saying yes. That is, you are showing him, yes, that you accept what he's saying. He should continue with what he's saying. Then it's like saying, oh, I see. And it's a way of encouraging your patient to continue talking. Because if you are talking, if he's talking and you're just keeping quiet and like sitting and looking at him, at some given point in time, you will be wondering, is this person actually listening? Or is it that he is staging on how he's going to confront me? But if you start nodding as he's talking, yes, you're saying something nice, you are helping the person to talk more. And that is what is more important, because in you carrying out your own checks, there is need for you to actively listen. Then, while actively listening, you seek clarification. So you're not judging him, but you're seeking clarification. So in your questions, you can say something like, I'm not sure I understand what you have just said. Is it possible you repeat it again? Or what do you mean by what you said? You're seeking clarification, because that is very, very, very important. Another thing you can say is, while the person is talking, he said, and the person is saying, maybe he's telling you a story about some certain things and he stops at some point, you can say, so what happened next? So that it gives the person room to keep on talking. And then you are now picking your points thereafter. Then making observations. Observations about the appearance can be very demeaning. If you just look and then you give the person some kind of looks. It gives your patient to withdraw. And then it gives the patient to draw more attention to you that's in some certain areas. But when you now begin to observe and then look at the patient with some nice looks, and then what are you doing again? You are now allowing the person. You are allowing the person. You are drawing your observations from what you are seeing. He's becoming relaxed. And as the person is becoming relaxed in talking to you, you are now still seeking more clarifications by chipping in questions. But if the person is not relaxed, that's why as a mental health counselor, it's not just to sit down and at the end of the day, you just write out on certain things, say, oh, this is what you should go and do. No, he becomes your friend. He becomes your paddy, as we say it in Africa, but you just need to be calm and then constantly seek clarifications by the observations you are observing. So when you see him scratching, you of course know that probably he's into some forms of drugs. But if he's not scratching, and maybe a person that is going through some form of anxiety, which is, of course, another form of a disorder. What do you do in a situation like that? The way you observe is how the person begins to talk irrationally and is not comfortable. You try to make sure that in the course of observing, you try to calm that person. And that's where compassion and empathy comes in. You put yourself in the position of that person and then try to see how you can make the person as comfortable as possible. Some people go through, in fact, everybody goes through some form of disorder at some given point in time of their lives. The young adolescents, as a result of peer pressures, adults, as a result of their work, their place of work, they are probably having stress at their place of work, or they're probably having stress at home. Everybody goes through one form of disorder or the other. But you as a counselor, the ability to observe and then be very compassionate. And in being compassionate, even the words you say, oh, everything is going to be fine. You know, the person begins to feel relaxed. The person begins to feel happy. The person begins to feel encouraged. Then, by doing that, one of the things you are offering is hope. Everybody wants some form of hope that things are going to be well. So, in talking to your patients, you should also build that hope that everything is going to be well based on your conversation with the person. Sometimes you can crack a little joke. The way you crack a joke to a person that is going through some form of drug abuse will be different from the way you crack a joke to a person that is depressed. You could tell a story. You know, it's more or less like a distracted therapy. You tell a story, and then in the course of that story, there should be some little form of humor to make the person laugh. That little form of laughing alone has a way of relaxing the person. Because the sole aim of what you are trying to do is to ensure that you get your patient comfortable enough to talk to you about every single thing that has to do with him or her. And once that is being achieved, then it is easy for you to counsel the person from that point. Reflecting. In the course of communicating with your patient, you ask questions. Is there anything that you feel as a regret and how you can change from that situation? Is there anything that you've begun to understand that you did differently and now you want to change for better? It's a time of reflection. And in the person's course of reflecting, the person begins to look at where the person is coming from and see hope of where the person could possibly be. The last but not the least is summarizing. At the end of your course with your patient, you will definitely have to summarize. And summarizing is from when the person came in. And of course, it's not a one-off session you're going to have in counseling your patients. But of course, you would have drafted out a plan. And at the end of the plan, you will summarize the various stages based on improvement your patients will go through. The last slide, please. The golden rule. What is the golden rule? Treat others the way you want to be treated. Imagine yourself, you are a counselor here, but if you want to treat and manage your patients well, treat them the way you want to be treated. Put yourself in the position of being a patient. How will you like your counselor to treat you? That is the way you should now treat your patients. With this little discourse we've shared this evening, I'd like to say thank you for hearing. And once again, we apologize for the little hitches that came up, and a very good evening.
Yeah, thank you so much, Mr. George Hembah. We are so happy to get these tips from you, and as much as possible, we would like to leave this program very, very simple. We are Africans, Nigerians in particular, because we are more in number. We want to know exactly, because most people coming to this program are new in this program. They don't have medical backgrounds. So after level 2, it gives them some kind of opening about what mental health is all about. They tend to be advancing further. And I think with such talks like this, it makes things a little bit more easier and less vague to them. So right now we know what it means to become a counselor. You know what we know already what we need to know about becoming counselors. Mr. George, there's one area we would like to talk about briefly, but before we go into that, we want to take some questions, maybe from 5 persons. I want to bring down everybody's hands so that we know exactly those people raising their hands. Please bring down your hand. Don't raise your hand, please. If you raise your hand, we are not going to call you to ask a question. And if your hand is already raised, bring it down, please. Yeah, one of the things we are made to understand, technopova, I have no choice than I might have to just log you out of this program, please. Whoever is technopova, please bring down your hands. Panama Benis, please bring down your hand. Let's go ahead. Let's know the people we are talking to. Okay. So now we'll go ahead, please. Mr. George, Oluwaseun, please bring down your hand. Mr. George, we'll be taking questions from 5 persons. And hopefully those questions will be able to answer questions, very likely questions from others. And please, anybody going to ask questions should just go straight to the point and very, very straight, and just 1 minute so Mr. George can do justice to that, because there's another important area I want him to talk about, which is not part of what we are discussing. Priscilla Abu, please bring down your hand. Eyitayo, please bring down your hand, please. Okay, Mr. George, are you there? Mr. George. Mr. George, please unmute yourself.
Okay, I'm with you.
Very good. Okay, we just need 5 persons. Please, if you are interested in asking any question, raise up your hand. Let Mr. George do justice to that. Okay, Eyitayo, please, over to you. Okay, we have 5 persons already. Eyitayo, over to you, please. Unmute yourself.
Hello, can you hear me now?
Yes, loud and clear, over.
Can you hug or touch your patient while counseling?
Okay,
Maybe
yeah.
trying to show emotion. Please.
Okay, Mr. George, before you answer that question, Eyitayo, were you here yesterday?
Yes, yes.
Did you hear the other speaker talk about this?
Well, the network was breaking somehow, so
yeah, because you are very specific about your question, and that's why I'm wondering why you asked that exact question that was answered yesterday.
Oh, well, I don't know.
Yeah, because
I thought the lecturers are different, so
no, please,
different opinion.
We don't allow that. We don't allow people coming to cross-examine our speakers. I think it's not too nice. A speaker told you.
I'm not cross-examining. I'm only asking a specific question.
Hold on, please. Hold on. You have already made it clear that speakers are different. Please, I don't think we have that luxury of time. Yesterday, you were told by a professional on the field that you don't hug clients. And today, I don't think
I'm not aware. I'm not aware of that. I'm just hearing that the network wasn't too clear in my area.
Thank you very much.
I don't know.
Thank you.
Thank you.
Yes, let's move on. Stella Emeka, over to you, please.
Okay, good evening, doctor. Good evening.
Yeah.
I just wanted to check if you don't as a mental health counselor, you don't have a medical background. Does it now mean that we need to go and study about these other types of mental disorders that you don't readily diagnose in Nigeria? For instance, typically people, if somebody has schizophrenia,
Yeah.
or any of those kind of stuff, right? What will normally happen in Nigeria is that they would tell the person to go to church and bind and cast instead of doing a proper diagnosis and helping the person.
Yeah.
So if you are from a non-medical background,
Yeah.
and you have now taken this level 3, what else should you have in your toolbox so that, I mean, you can put your certificate out and somebody says, oh, come and do something for me online, and they now give you somebody that has bipolar, and it looks as if you're the one that is the patient. So please, what else can we?
Okay, Mr. George, over to you.
Anyway, basically over here is mental health, like every other profession, requires that you keep on updating yourself constantly. If you have a patient that is going through schizophrenia, or otherwise known as a bipolar disorder, it doesn't mean that you need a medical background. That's the reason why in mental health, there are courses where you have cues that you look out for. And when I mean cues, it's just like saying you have lead-ins. So if you see a particular patient of yours behaving in a certain manner, that's why there are toolkits in the area of mental health for every counselor. In those toolkits, it has suggested cues that if you see a particular patient behaving in a particular manner, or there are some behavioral traits going on with such a patient, your patient, you now know that these are the possible symptoms of a bipolar disorder, schizophrenia. And these are the possible ways of how to manage such a patient. But it will not just be at a single sitting or a single a one-off meeting you have with your patient that you can now conclude that this is what the person is going through. So the person has to undergo series of courses which you would have taken your time to set out for your patient. Did that answer your question, please?
Okay, I think she might not be, okay, let me unmute her. Why she's going to respond to whether you've answered her or not, which I believe you've done. I also want to inform everybody that we have made arrangements.
Okay.
We have made arrangements to list out all major mental health challenges that people encounter in every society. And once we list them out, we list out possible areas of remedy, areas of identification, and all the necessary things you need to go about them. And just like Mr. George rightly said, you need to keep studying. Ours is to give you as much as we can give you. If we really want to give you all the things you need to get to become what you think you need to become, I'm sure you have a full encyclopedia to go through, and that might not, by the time you finish it reading, you discover that you don't even have time to practice anymore. So as you keep progressing, like next year, what we intend to do is that after the whole program, you'll be attached to persons with some of these problems, not necessarily with psychiatric hospitals, and you'll be there to provide solution and try to solve problems, not just going for internship, but this time around solving problems on the field and understanding your progress and what you are achieving. So Mr. George just said it all. Please keep reading, keep studying, keep learning from other sources, while we also do our part to give you the list of mental health challenges you'll be encountering and the solutions, the ways of to remedy them, the possible cues for identifying them, and sitting down and running a course on each challenge. Thank you. I hope Mrs. Emeka, Stella Emeka, I hope we've taken care of this problem for you. Stella Emeka, are you there?
Yes, yes, thank you so much.
Thank
Yes,
you.
thank you.
Thank you.
Thank you.
Priscilla Abu.
Hello, everyone. Good evening.
Good evening.
Thank you so much, Ms. Councillor George. This has brought so much light to us, and I can see the value in this level 3. Now, my question has a little bit of specific answer to what doctor has just said, that if you are going in for the first time to have encounter with patients, what area should the mental health at this stage where you need a lot of studying, a lot of understanding of the different areas, what should the students focus on at this level of internship when you go out practically, so that you don't just mix up issues? What should they really focus on? Should they just take up every case? No, they don't have that light. So in this learning, what should they focus on so that they will not just waste of it? I don't know if my question is clear.
Yeah.
Well, the first thing is that people, I said something in the introduction that you are going to be experiencing, or rather relating with patients from different cultures and different upbringing, different spheres of life. And you going in for the very first time, you definitely go in. That's the reason behind the internship. Because when you go through the internship, you begin to understand various cases. You can have 2 different patients with the same case, but the approach and manner in which you are going to handle them will differ. So if you now want to say that you're going in for the first time and then you want to select, you will not really select. That's why you need to be broad in your understanding. And being broad is because one of the things that a mental health counselor is equipped with is a toolbox. I don't mean the physical box, but then it gives you cues to the various kind of ailments or illness or disorder. And then that's where behavioral traits come in. That if you see a certain person going through this or acting in this certain form of manner, these are the possible reasons behind such a patient going through that. But you will not end there. You have to probe further with further investigation. So your first meeting with your patients for the very first time, you could sit and be very nice. That's where accepting comes in. That's where communication comes in, because you are communicating based on what you are saying, how you are saying it, and your body language. And the same thing goes vice versa. What is your patient telling you? Because he's going to be communicating both non-verbal and verbal. And in the verbal, what is he telling you? How is he telling you some certain things that he's going through? And then his body language. What is his body language speaking? He can be telling you something completely different from what his body language is communicating. And that's why different sessions that you are going to have before you arrive at possible way of managing such patient is because it's not a one-off, it's not a two-time session, but it's going to be periodic. And then in the course of your session, you're also going to be discussing with your superior, who is going to guide you through those processes. Okay, if you meet with a patient in this form, this is how we manage such. So for every case that you have sat with your patient over time, for the very first time or second time, you are taking your notes. It's very important. And then you discuss with your superior who will guide you through. So you're not just going to be thrown into the air, into the market, and then you get to relate with your patients directly, and then you now get yourself confused. No, you're going through the rudiments. just like Dr. Osaze had mentioned, there are still some areas that we have to undergo. It's going to be streamlined that these are the various types of disorders, and these are the possible ways of addressing such disorders. It's a course of its own that definitely, when you get to understand this gradually and you begin to put it into practice, then you now begin to understand the whole area of counseling. Thank you.
Okay, Madam, I hope this answers your question.
Most definitely. Thank you so much. I
Thank you.
think we are even having value here more than those that may be at the field. That's what I observe. Yes.
Thank you, Madam.
Yes. Yes.
Okay, 3 more persons. Oluwaseun, over to you.
Thank you, Dr. Ozase.
Mm.
And thank you, Dr. George. My question is, actually for my internship, I was doing my training at an hospital. So my question is, how can someone then consult a patient that has, for example, malaria?
Sorry, is it
Because
possible
when
you speak out?
Okay, sorry, sir. So my question is, for someone that is doing internship or training at the hospital, because I could recall back about 2 weeks ago, I was opportune to do my training at the hospital, and the sister there asked me that you are here for mental health training internship program, but we don't have patients here. I don't know where to put you. I don't know what to do with you. And I was like trying to like convince the nursing sister that people with people that like a patient that comes around with maybe headache or fever or whatever, somehow some of them might be going through some mental health issue or mental issue. And the sister was like, I don't think we need people like you. I was like trying to like, because I want to attach myself to an hospital, part of the our training program, and part of the write-up they gave us. They said we can go to hospital, we can go to prison, we can go to church, we can go to mosque for counseling, all that. So my question is, because right now, and even I even made up my mind that, okay, I will counsel a pregnant women who are having mental disorder. Or
Sorry, can you speak up? I can barely hear you. Sorry.
Oh,
Please
okay,
speak up.
okay,
I can barely hear you.
Okay, so okay, let me just go straight. How can a mental health student going for internship, how can they work in a hospital? That is not. How can they work in an hospital? Hospital.
Okay.
Hospital. How can someone wants to go for an internship in an hospital that is not
Mr. George,
psychiatric hospital? Yeah.
Mr. George, before you answer that question, let me give you a background so that
okay, sir.
you're also part of this system. One thing I need to point out clearly is that one of the first things you need to tell yourself is that you need to be honest, you need to be straightforward, and you need to be deliberate in everything you want to do in life.
Okay.
When we noticed that people were being posted out to some places, especially by the insurance firm, and some of the so-called NHIS centers were even in people's houses. But that is not even our business. That is them and the federal government and the insurance firm. Of course, you know what happens in Nigeria. When we noticed that was what was going on, all the figures of hospitals all over, it was actually not true that hospitals were all over and they were connected to this hospital. I'm sure they don't even know that some of these people claiming to be hospitals were actually owners of, they were just in their various houses. We now said, okay, these are the list of places you can do your internship. Churches, the prison yard, remand homes, hospitals, psychiatric homes, NGOs, even mosques. For churches and mosques, it could be a counseling unit. And as I'm talking to you, I'm sure we don't even have up to 10 people that got places to do their internship in churches. Only one person approached me to do internship in the prison. In fact, NGO, maybe just one or two. For all the thousands we have, everybody wants to do internship in the hospital and the psychiatry. And the question is why? It means that there's something that probably we don't seem to understand, or we don't want to understand. Internship, mental health is not restricted to a psychiatric hospital. Mental health issues is rippling everywhere, in the army, in the police, in remand homes, in churches, even in our homes. And I expected everybody to say, wow, I have 2 or 3 places. Which one will I choose? But we keep having complaints, even up to the extent that some hospitals are asking people to pay money. And we say, why should they pay money? Well, they even told this hospital they have paid for internship, so why should they pay another money? And I say, wow. So please, I don't think we have any reason whatsoever to have any problem with this program. If we want to be honest, if we want to go straight forward, sometimes people say I'm very blunt, but I think I prefer to be blunt, and let's get things done. We can all bear witness to the fact that even though some of us here have not even done physical attachment, what we are getting here might even be far better than what some people are getting on the field, like Oluwaseun in the hospital that is not having anybody to talk to. So what is he doing in the hospital? When there are NGOs that specifically engage persons with mental health issues, and that is where it should be. There are churches with counseling units that handle cases, like in my church. They have a department that handle people that have issues with drug, with addiction. These are places that people should go for internship. And honestly, you even do far better. So, Oluwaseun, you don't need to convince them, and don't go and create problems for yourself, trying to convince the
Doctor, like the sister told me, Doctor, sir, I'm so sorry, sir. I'm so sorry, sir.
Yeah.
Please, sir, I want you to hear me out, sir.
Yeah.
Because I'm already in the program. I've been spending about up to like 3 weeks now.
Yeah.
At the hospital. And then the sister told me that, okay, one of these days I'm going to give, because they have these pregnant people and they give them antenatal talk and all that one of these days I will talk on mental health for pregnant women. You know, so I try to like, okay, develop some notes. I do some Google. I have already write out my notes concerning that for them on depression and anxiety. Now, aside the talk, I'm so sorry to have this, sir.
Yeah.
Because I already spoke to you one-on-one, and you list out area where I can do my internship.
Yeah.
But I just want to know, because even in that hospital, I've been so impactful, because I do help the nurses as well to do the blood pressure and all that. But my role as a mental health student, I don't know how to, you understand? I don't know, maybe you get my point, like how to, who am I to consult in an hospital? Maybe they rush in at someone that has an accident from the express, or someone that has an high fever or typhoid. How can I communicate with such people?
Well,
yes, sir. I'm so sorry, sir. Yes, sir.
First and foremost, I personally, I go through our training text once in a while.
Yes, sir.
Anytime I go through, it's like I've never been through that text before, and I start discovering things on a daily basis. Now, if you go through the training material, you'll be shocked that even while there's talking to the nurse, you will start identifying people with mental health issues. However, I don't think you need to go about identifying people with mental health issues if they don't ask for it, or if you are not directed to do that. And that's why we say, get to organizations that have this department. First, they will guide you and place you somewhere, and they will run you around the different courses in handling mental health issues in their organization. But whereby you have an organization that doesn't have any of these cases, and you want to bring up these cases there, it might become even an issue for you. And that's why we say, rather than wasting too much time, go where you have cases on ground that are professionally pursuing such courses. It is even easier and better for you to quickly develop. Anyway, let me hand over to Mr. George.
All right, sir. Thank you so much, Dr.
Okay, Oluwaseun,
yes, sir.
I'll attempt to answer your question. But let me ask you a quick question. What is mental health? And then what is mental disorder?
Okay, sir. Mental
Just 1 minute.
Is, all right, sir, is a well-being. For a simple,
well-being. That's mental health. What about the disorder?
That's when there's it has to do with emotional
when the person is going through
disorder.
When the person is going through, let's put it in summary, issues.
Okay, sir. Okay,
right?
Sir.
Now, I'm happy that you understand the basics, you understand the difference between the two. And now, if you are discussing with them in the hospital that you are, you should be able to now explain to them that you are not a psychiatrist. That's the reason why I defined what a psychiatrist is. You are not a psychologist.
Yes, sir.
And that's the reason why I defined what that is. I think I'll share with Dr. Osaze later the little slide that I had. That shows you the definition for a psychologist. It also shows you the definition of a psychiatrist. Now, in the hospital or a school or the prison, you are going there as a counselor.
Okay, sir.
And that's the reason, again, why I defined who a mental health counselor is. It was deliberate, because when you know who you are as a counselor, your approach to even your superiors where you are working will differ. You tell them you're not here as a doctor, you're not here as a psychologist, you're not here as yes, but this is the role of a mental health counselor. And let me say it again, let me define it again, that your duty is to assess and treat mental and emotional health disorders, relationship issues, and life challenges. That is your duty. And you do this how? Through methods of psychotherapy, counseling your patients, and then you are now developing a pattern to help them. So when they now ask you that, okay, this person is having malaria, you have no business with the person having malaria, except if the person is under distress, under some form of anxiety, because he has malaria, but he doesn't know what he's having. It could be something else. You know, typhoid and malaria has similar symptoms. Yes. And then a person having it maybe for the first time, or he's thrown off balance as a result of one thing or the other. What is your duty is to investigate. And how do you investigate? Is by those techniques I had mentioned earlier. If you are sitting with a person, even with his malaria, what would have caused the malaria? Obviously, it's mosquitoes. Where did he sleep? Did he sleep outside? Who is this person? What does he do? Okay. By the time you are sitting and engaging him in a conversation, you'll be able to decipher if he's having a disorder. Okay. Because what you are trying to understand, you want to get at the end of the day is if he has a disorder, and then how do you manage him from that point? Okay. So in your hospital, you can, when you now explain to them your role as a counselor, even if that does not exist in that hospital, it can be created with the sole aim that you will be counseling people in that direction. I want to believe that that has addressed your question. Oluwaseun.
Perfectly, sir.
Thank you. Thank you,
Perfectly, sir.
Mr. George.
Thank
You've
you.
really done
That's
justice to that.
yeah.
And I want to believe that Mr. Oluwaseun has taken a cue from that too. Yeah, so we have to move
Yes, sir.
ahead so
Thank you,
that
sir.
we can take care of others. Please, before we go ahead, those persons that are posting answers on the general wall, please kindly desist from it. If you have all the answers and you can answer questions, I don't think this program should have been for you in the first place. We have a trainer here, he's an expert. In fact, when we say he's an expert, he's an authority in the field. And I also even dove my heart for him. He's even a boss as far as I'm concerned in this aspect. So I personally will not even claim knowledge over him as far as this area is concerned. So I think it's just nice that we desist from responding to other students' questions and allow him to offer solution. Even when I talk, I still want to hear him say the final word. So please, let's do that and listen to him so that we can get the best out of this. Now, some people, Mr. George, in as much as everybody here is a student, from the questions some persons have asked, I'm beginning to have an idea. Something else is coming into my brain. I always I bring up ideas once in a while. So I'm always thinking of ideas that will make things better for everybody. Some persons are now asking that, what is our title as students who have completed the level 3 mental health program, though they've not completed it anyway? Well, what will be your suggestion? What would be their title? What do you think should be their title?
You're an intern.
No, after the program.
After the program, you are a counselor but you have to get to be certified as a counselor. So yes. So you are a mental health care counselor, and then in mental health care, there are counselors with specific areas of specialization. Because mental health on its own is very broad. There are some that we want to specialize strictly on suicide missions. There are some who would like to specialize strictly on the behavioral traits that they find in a drug-addicted patient. There are some, so that's, in that way, if you want to specialize in any of those areas, it makes it easier that if you are, for example, in a hospital, then, and that unit is being created, the nurse is referring a patient to you strictly in your area of expertise. Because mental health is very broad. It's really, really very broad. You can have a bit of knowledge from all the various areas, but you could specialize in a specific area. So you are regarded as a mental health care practitioner.
Yeah.
And then you begin to build from that point.
Thank you.
To become a counselor.
Yeah. I know that level 3 is a way ahead of level 2, and that we have other categories and levels people need to aspire to. With what you have here, you can actually start practicing. And may I also quickly chip in here that we are not running this program for immigration purposes, for people to start migrating to UK. This is one big area everybody needs to understand. We are running this program because we need to run this program. If you actually need to use it to migrate to UK, fine. Because it's CPD accredited, you can use it in UK. But that is not why we are running it. So if you want to migrate to UK, it's clearly a separate issue which you need to pursue individually as a person. We also have people that do this program and use it to work in Nigeria. They used to work in other African countries. We have students from other African countries, in fact, from other countries. So please kindly understand that you need to understand what you are studying. Some persons, according to my student here, some people don't understand this program. Yes, they don't understand this program because one of the things I've come to realize that everybody just goes straight to the answer. You know, when we are in secondary school, if you do your mathematics, there's this answer, the book, the textbook. I don't know what they use now. Behind the textbook, they will give you a question on the textbook. Then behind, they will write all the answers, the correct answers. So once the teacher gives you an assignment, because you know that you don't know the answer, you just do some solutions here and there, scattered like that, and go behind the textbook and copy the answer. And it looks as if, yes, that is the right answer to the question, but the solution is wrong. So please, if you are in this program, this is a candid advice. If you are in this program, we will do our best to make sure you know this program because you've gone through this program. We'll do every technique we have to make sure you understand this program. But on your own, tell yourself that you have chosen to become a mental health practitioner. Then upon that, specialize. Don't worry, we'll provide you with all the areas you can specialize in and how you can go about the specialization. But for now, at the level you are, you can work anywhere in the world with this level of knowledge. Tell yourself that you must become the expert that you are supposed to be. Tell yourself that you want to be better than anybody with a level 3 anywhere in the world. We have all it takes for you to become that. We've provided you with everything. The ball is in your court. Okay, having said that, let's move ahead. We have 2 more questions to take. We still have about 16 minutes to go. Folusho Aderi Bigbe. Aderi Bigbe. Please, let's make it very brief so that.
Okay, good evening.
Good evening.
Can you hear me?
Your background is very noisy, Folusho. Yeah, you.
Okay. I want to commend your this very program.
Thank you.
In fact, it's very enriching even than being on the field.
Thank you.
Actually, I opted for the field internship too. And, I went to so many places, but I eventually had to stick to the rehabilitation center for now.
Yeah.
And I now discovered even at the rehabilitation center, most of the staffs there does not even know, from the theory we have taken so far. We have
Your network is breaking.
Yeah, the network.
Your network is breaking.
The rehabilitation center, they have. Is it better now?
Yeah.
Okay. So and now I had some issues with the staffs. Those patients that are actually psychotic, I took time to some of the staffs are even running away from those. Some of them, they term them to be violent and the likes. But maybe I just think from my own nature, I'm able to flow with them a little. But when the doctor came around, it was like, who are you? What do you do? After explaining to him, it's like he's not comfortable with me. I don't know why. So, but from he's able to see, he's even asking me, are you a doctor? I said, no, I'm not a doctor. I'm not even in the field of health initially, but I took interest in this, and that is why I did this training, and I'm enjoying it. So, I'm just now of the opinion, because I got, I would have been able to even educate doctors and the nurses more if we had done this class, this Zoom class we are doing right now. Because from yesterday's class and today's class has even enriched me the more, that even if I have had this before the encounter I had with the psychiatric, the doctor and the nurse, I would have even been able to be more equipped discussing with them. So I'm of the opinion and suggestion that for subsequent batches of training, this kind of Zoom class should maybe come up before they now opt for the field internship. They will be more equipped with that.
Thank you. Thank you very much.
Even with my the staffs of the rehabilitation center, they are saying that the next batch of trainees that will come in for this training, they want to do the training, even from their director level. So it's a good work that this thing is, you are spreading that message And I know that with time, the this training will like impact a lot of people in the field of clinical psychology, counseling, and the others. And please, one more thing. I want the slide for this CPR to administer CPR, the one we did yesterday, the video. I'm yet to get the link, and even like a PDF slide or even a video of today's section too. Please, I will appreciate it if that can be put across to us too.
Yes, thank you, Mr. Folusho. First of all, I commend you. Though it was maybe like last resort, you found yourself in a rehabilitation home. It's actually a very good place for you to actually see it practical for yourself and see it live. It's a good place. And just like you said, you know, we have always told you that this is our first mental health level 3. There's no point hiding or pretending about anything. And the next level 3 we are doing is going to be, let me not say perfect, but I can assure you that it's going to be close to near perfect. And for most of you that want to have a practical feel, if you have a place, our doors are always open to accommodate everybody as much as possible, as long as you've done this program before. So we are not closing our doors to anybody. But like just Mr. Folusho said, the next program we'll be doing, everybody will need to go to the normal text class, do some assignments, go through the Zoom program, and do some assignments. Like tomorrow, we're going to do some assignments, then write a series of tests. Then after that, I think there's nobody, no matter how you want to pretend, you just discover that you just know mental health properly. You just have no choice but to know it. Then you can go to the field. And we are making serious arrangements for internship next year. It's not going to be like what we have now. Nobody is going to be asked to pay a dime. As much as possible, we'll try to avoid that from anywhere. And you do your normal time of internship on the field, and you'll be happy for it. And I like I told somebody yesterday, I said, even after getting your certificate, nothing stops you from going to do your practical somewhere whenever you have the opportunity. Just know what you need to do and know where you need to do it. It must be in the hospital. Like Mr. Folusho just said now, he's enjoying his time where he is now and discover that persons working in such places that should even know and teach him, he is even coming to teach them. You can see that you are even solving problems already in the country. Okay, thank you very much.
You're welcome, sir.
Yeah, thank you. Okay, I thought Yetunde, I thought the idea was to be able to get jobs in UK. Well, I don't know who introduced you to this program, Yetunde, but anybody that knows me will tell you that I don't say things I don't do. We are not immigration agents. We don't do immigration. In fact, I don't get engaged in such things. However, one thing I can assure you is that our level 3 is CPD accredited, which means you can use it in UK. And if you, for any reason you find yourself in UK, you can tender the certificate. You can even get in touch with our UK partner, like he's doing with about 50 persons right now that are in UK, some others in Europe. And I can also assure you that you will be respected and honored. But that you are doing it because you want to apply for a visa, I think it's a wrong notion, because we have over 2,000 students doing this, and I don't think more than 200 or 300 are going to UK with it. So I don't know. I just wanted to clear your doubt about that. So please reposition your mind. And it's very good if you want to go to UK. I welcome you to UK. I appreciate that. And I wish you the very best going to UK. And going back to Mr. Folusho quickly before we move ahead to the last person. Mr. Folusho, you said when the doctor spoke to you, it was like confused a bit. I want to let everybody know here that in this course, we have medical doctors. So please don't have this impression that every medical doctor already know about mental health. Don't make this mistake that every medical doctor is versed in mental health therapy. And so if you meet them, they already know who you are. Because I'm telling you this because we have a lot of medical doctors also taking this program, and they can bear me witness that it's a different field that they need to come into too. So you understand this program will be able to complement doctors in their field in areas that concerns mental health. So please see yourself as an expert that is coming up. And by the way, after COVID-19, after HIV, mental health is becoming the next global pandemic. And the earlier you position yourself to be able to prefer solutions, the better for you. Be the new solution in the world that the world is looking out for. You get it just United Nations. In fact, I'm going to share you some links how you can go to United Nations and United Nations Volunteers database, upload your database, upload your certificates, upload the courses you've done. And that's why they're even doing a course with WHO. Get some of these certificates, and the fact that you've done your internship will be there. Put in your forensic experience, and you'll be shocked. You'll be called up for appointment or voluntary role with United Nations Volunteer. We are very serious about our program. And I want to repeat it once again. We want to make sure our level 3 training is far more advanced than the level 3 training being done in UK. Take my words for it. And I mean it, and it's going to be like that. At the end of the day, you will be better off doing level 3 with us than somebody even doing it in UK, because we want you to come out the best for it. So let me take one more question from Chinwe Eurum.
Thank you, Doctor, for this opportunity.
Thank you.
Thank you, Councillor George. I have two questions. One is when Councillor George was talking to us, he talked about taking notes. And I want to ask, if you have a client before you and the client is averse to your writing down what you're discussing with him, what do you do? And even if you want to use your phone, maybe to record, do you do it openly or secretly? If he or she doesn't want, you to put down the information. And then my second question is, how can we get certified as a mental health counselor? Thank you, sir.
Okay, you want to say something, Doctor?
No, yeah, go ahead.
Okay, the first question, right, is that you are a counselor, and then when you have your patients coming in for the very first time, you have to, as I told you, you have to be accepted. You have to show some form of acceptance and let the person feel comfortable. And you let the person know that you're not coming to advise him and to see him through what he's going. And there is need for you to jot down some few things so that there is a follow-up. Yes, but you have to let your patient know that first, because some patients can be, yes, and then you don't just start taking notes immediately. You let the person to be as calm and see that you are trustworthy. So sometimes, even for the very first time you are meeting with your patient, you may not take any notes. You might just sit down and then try to make him comfortable. And then you book another session. For each set, so for the next time he's going to come, how are you doing? How was your last session? That, okay, now we're advancing. Because for a person to come the second time, it means he's gradually trying to show that he understands his current reality and wants to be better. Because if a person does not understand his current reality, you'll be practically wasting your time. But how does he understand his current reality? It is by acceptability of who he is. And when you see that by virtue of making him feel comfortable to talk to you, and then you now say, okay, we're going to book another session at a particular date. When you now book it at that date and he comes, you now say, okay, these are the ground rules. It's quite simple, as you have to jot one or two things to help him at the end of the day. So you're not doing it to accuse him of anything. You're not going to use it. So there should be some form of secrecy, because many people don't want to be exposed to whatever they are going through. And they don't want to look as if you, the counselor, is going to expose them. So you really need to make them very comfortable to be able to now sit. And then, of course, it's not every time you're going to jot. There's some certain things you can reason it out. So you're jotting less, but you don't need to use your phone. Professionally, you shouldn't use your phone at all because it can interpret anything to that patient that comes your way. Your second question is, how do you get certification? There are a lot of mental health institutes, especially, so it is now for you to now choose which institute do you want to go to. There are one or two courses that you also add, and then you get a certification. But the certification gotten even here from Plage is a very good certification, which is well recognized.
Awesome.
Yes. So have I attempted your question right?
Yes, you have.
Thank you.
Thank you very much.
You're welcome.
I'm grateful.
You're welcome.
Thank you, Madam Chinwe. May I say that you've not seen anything with what we are planning and what we are doing. Where we are heading to is somewhere that will shock everybody. So if you have somebody like Mr. George here, you had somebody like Joy at TV yesterday, you are going to meet Mr. Komolafe tomorrow. Then if you put 1 and 2 together, you know where we are going to land. And I deliberately sent you their profile for a particular reason. And if you understand how to put 1 and 2 together, you know we are heading somewhere. So please just relax. And when by the time you land, you will say, wow, thank God I'm an African. Yeah. Please, for everybody that is lying down or wearing singlet, I will start exiting you gradually. You know yourself, please. It's not a good thing. If you are sitting in front of a client, I'm sure you'll not be lying down talking to the client. This is not a good score for you if you are doing an interview with a foreign firm. Okay, let's use this remaining few minutes. It's 9 o'clock already. And we are supposed to have closed, but I know we had very important questions we are answering. The person in Qatar, Sarah, you please try and get in touch tomorrow. You can use our certificate anywhere. I think the most important thing now, apart from the certificate, is you being able to practice what you said you learned. Then we are very, very ready to give you a reference letter. You are a student, feel free, but let's do that tomorrow. Okay? And then I will still complete this program on the 10th of December. Of course. We are heading well. Thank you. Okay, Mr. George, this is the last question I'm going to ask you, and it's coming from me. Can you briefly tell us, in just 5 minutes, the prospect of students doing this program to work abroad or work outside their immediate geographical environment using this certificate, which means working virtually? I think you should be able to explain that better for us.
Okay, thank you very much, Doctor. There's a lot of prospects because the world at large, everybody is going through something. No matter how little it is, everybody's going through something. And the way we manage issues here in Africa is quite different from the way we manage related or the same kind of issues in the Western world. So the prospects outside are more. You know, the good thing is that the certificate that is gotten here is well recognized, you know, and it is our duty as those participating here to actively go online. There are a lot of sites that you can go to and start checking for opportunities. Some will want you to be physically in their country for you to get an employment. Some will want virtual. And I do some virtual consulting. And how do I do that? I have some few friends in the UK, in Canada, and in the US. And when they got to know that I had some certifications in mental health, it came through referrals that, oh, okay, you have an African that can also sit with you and counsel you, understand what you are going through, and advise accordingly. When you have such kind of a client, as I said earlier in the earlier part of our presentation, that different cultures, different upbringing, different orientations, the way and manner at which you relate with such person differs. So if, for example, you say you choose that you want to consult for your patients in the UK, you need to understand the people based in the UK, what attracts them? What are their pleasures? What do they have? How do they react to some form of impact? The advent of COVID, we were able to manage COVID here in Africa to a reasonable extent. But over there, many people were dying out of fear, out of anxiety, out of depression, not being able to manage it. We have a very strong mechanism over here, a coping mechanism over here in Africa. Now, if you have that as a counselor in mind, you now begin to ask, you appeal to the intelligence of your patients. Of course, you are making your research. So constantly, that's one of the things that as a counselor, you need to make your research. You need to concentrate that research into whoever you are counseling. So for prospects, you have a lot of prospects, especially in the Western world. Thank you.
Thank you, Mr. George. I wouldn't want to belabor that further. The long and short of it all is that you have huge potentials in front of you, and that you must not necessarily travel to be able to use your certificate. And that beyond your certificate, you need to research, you need to read further, you need to learn, you need to unlearn, and you need to learn. There are huge resources out there. Certifications are coming that gets you certified, and you can be sure that you are becoming a transformed human being that makes people happier in their life, just even from your home. So please just get ready for that position. It is beyond, what we are doing here is beyond just level 3. We are building up a big force. And like I told you, a very massive association is coming up very soon. So there are so many things we might not need to say here on air. So once it is happening, you'll be contacted, we have your contact and everything. Thank you, Mr. George, Hembah. Thank you, everybody. Ladies and gentlemen, tomorrow is going to be another explosive day. Yesterday was wonderful. Today is wow. Tomorrow is going to be, in fact, tomorrow, some of us, we have to be treated on mental health issues right here on the screen. So you see it happening live. I hope you've printed your papers. I hope you've tried filling one and see the score and see, because I know if some people feel their own, they might not want to attend the program tomorrow, but don't worry, just attend. I will fill mine too and I'll attend. After all, some students say that I also have mental health issues. I said, no problem. Everybody have it. So please, tomorrow, just be on time. Tell everybody to be on time. Please, am I okay? Thank you, everybody. Thank you, everybody. The slide will be sent to you. Just be patient with us. The one of yesterday is being uploaded with the video, even though the video was sent to the class, but we are going to upload it to the training classroom online on our website so that you can log in anytime and read. Today's one is the same thing is going to happen. So just give us today and tomorrow to sort out that of yesterday and today. It's a whole lot of work to do, but we are doing it. And after some time, you don't even need to go to your WhatsApp group to check for those things. Just sign it back to the class and you'll be able to study everything you've done before and catch up. Thank you very much. God bless you all. See you tomorrow. And just know that this video is going to be saved, and invite everybody that are not in the class to be part of the class tomorrow, especially to come and take their own treatment too, free of charge, from Mr. Komolafe. Thank you and God bless you.
Thank you. God bless you, sir.
Thank you. God bless you. God bless you.
Good night.
God bless you.